Welcome to our channel Medicine World. In this episode we will discuss on anti-diabetic oral drug, Metformin Hydrochloride. Let's start. Therapeutic class. Biguanide. Metformin decreases hepatic glucose production, decreases intestinal absorption of glucose, improves insulin sensitivity, and finally increases peripheral glucose uptake and utilization. Results: improved blood glucose control. For adults, typically, metformin starts with a usual initial dose of 500 mg twice a day or 850 mg once a day, taken with meals. Dose adjustments can be made gradually, either increasing by 500 mg per week or 850 mg every 2 weeks. The maximum daily dose is 2,000 mg, taken in divided doses. For those needing further glycemic control, the maximum daily dose may be increased to 2,550 mg. Given in divided doses. Doses above 2,000 mg can be better tolerated when taken 3 times daily with meals. For children, metformin typically begins with a starting dose of 500 mg twice a day, taken with meals. Dose increments can be made weekly, increasing up to a maximum of 2,000 mg per day, taken in divided doses. Metformin extended release tablet. For adults, the usual starting dose of metformin XR is 500 mg once daily, preferably with the evening meal. The dose can be increased by 500 mg per week, up to a maximum of 2,000 mg once daily with the evening meal. Alternatively, it can be increased to 1,000 mg twice daily, taken with meals. Patients currently taking metformin immediate release tablets can switch to metformin extended release tablets, but not exceeding the recommended maximum daily dose. For children, metformin extended release tablets have not been studied in children. Interaction of metformin with other drug. 1. Limited information on chronic interaction with furosemide. 2. Enhanced absorption with nifedipine. Nifedipine appears to enhance the absorption of metformin. 3. Potential for interaction with cationic drugs. Cationic drugs eliminated by renal tubular secretion. Cationic drugs such as amiloride, digoxin, morphine, procainamide, quinidine, quinine, triamterene, trimethoprim. Vancomycin may interact with metformin by competing for common renal tubular transport systems. 4. No effect on cimetidine pharmacokinetics. Metformin has no significant effect on the pharmacokinetics of cimetidine. 5. Drugs that can induce hyperglycemia. Certain drugs, such as thiazides, diuretics, corticosteroids, phenothiazines, thyroid products, estrogens, oral contraceptives, phenytoin, nicotinic acid, sympathomimetics, calcium channel blocking drugs, and isoniazid, may lead to hyperglycemia and potentially impact glycemic control. Contraindications: hypersensitivity to the active substance or to any of the excipients, acute or chronic disease, which may cause tissue hypoxia such as cardiac or respiratory failure, recent myocardial infarction, shock, hepatic insufficiency, acute alcohol intoxication, alcoholism, acute conditions with the potential to alter renal function such as dehydration, severe infection and shock, any type of acute metabolic acidosis such as lactic acidosis, diabetic ketoacidosis, severe renal failure GFR lesser than 30 ml. Side effects: blood and lymphatic system disorders, metabolism and nutrition disorders, decrease in vitamin B12 absorption with lowered serum levels during long-term metformin use. Consideration of this cause is recommended if a patient presents with megaloblastic anemia. Cases of peripheral neuropathy in patients with vitamin B12 deficiency have been reported in post-marketing experience. Frequency not known. Nervous system disorders. Most common: taste disturbance, gastrointestinal disorders, hepatobiliary disorders, skin and subcutaneous tissue disorders. In pregnancy, uncontrolled diabetes during pregnancy, whether it's gestational or permanent, increases the risk of congenital abnormalities and perinatal mortality. It is advisable not to use metformin to manage diabetes when planning pregnancy or during pregnancy. Instead, insulin should be used to maintain blood glucose levels as close to normal as possible, reducing the risk of fetal malformations. Metformin is present in human breast milk, but no harmful effects have been observed in breastfed newborns, infants. Due to limited data availability, it is not recommended to breastfeed while taking metformin. The decision to discontinue breastfeeding should be carefully considered, weighing the benefits of breastfeeding against the potential risks to the child. Bangladeshi brand, Comet, tablet 500 mg, square, Comet XR, tablet 500 mg, square, Comet, tablet 850 mg, square, Comet XR, tablet 1000 mg, square, Informant, tablet 500 mg, Biximco, Bigmet, tablet 500 mg, Renato Limited, Medfo, tablet 500 mg, Pacific, Oramet, tablet 500 mg, Drug International Limited, Novsit, tablet 500 mg, Incepta, Zelmet, tablet 500 mg, Beacon Pharma, Innovator Brand, GLUCOPHAG, Merck Sansas, a subsidiary of Merck KGaA of Darmstadt, Germany. If you like this videos, please subscribe. Push the bell icon for getting more videos regarding Medicine World. Thanks for watching.